Knock, knock. Hi, Bob. My name is Sarah. I'll be your nurse today. As I enter the room, I'll wash my hands and provide for privacy. So today, the doctor has ordered me to insert an NG tube into your nose, and that'll go down into your stomach. Just since you have that bowel obstruction, he wanted to get the rest of the contents suctioned out of there. Do you have any questions or concerns with that? He says no. He's had an NG tube before, so he kind of knows what to expect. He knows that it will be uncomfortable, but it shouldn't hurt. Can I have you state your first and last name and date of birth? And he does, and it matches my order. Okay, so we can get started. So first I'm going to place a towel down on your gown just to make sure we don't spill anything on your gown. Do you think you'll be able to sit upright and still for this? And he says yes, he will, and I have him already in the high Fowler's position. Okay. And then I also have a basin, an emesis basin in case he were to gag and needed to throw up at all. Okay. So I'm going to put on some gloves, and I'm just going to assess your nose and your nares, and then assess your gag reflex as well. So I'm going to take my tongue depressor, and I've gathered my supplies. I have my emesis basin, my towel, my tape, hand sanitizer, my tube with the connection for the suction, my suction tubing over there, my tongue depressor, measuring tape, my pin for connecting it to his gown, and a cup of water, and then my pen light. So first, I'm going to insert this into your mouth and just check your gag reflex, okay? So I do that, and he gags, and he's good. And the patient is not NPO, so it would be okay with for him to, we'll put this in garbage, it would be okay for him to drink water while I'm inserting the tube. So then I'm going to check his nose, looking in, assessing the patency. Alright, I'm gonna plug one side of your nose and then have you breathe in through your nostril, and then breathe in again. And which side feels like you can breathe more freely through? He says his left nostril, so I'm going to use the left side. Okay, so I'll take off my gloves, wash my hands. I'm going to get my tape ready for when I have to tape it to the patient's nose. And then I'm going to get my tape ready to label the tube for the correct placement. So, wash my hands. And then I'm going to take the tube out, and I'm going to measure from his ear to his nose, and then down to see how far I should insert the tube without touching it to the patient. I'm going ear to nose and then down the xiphoid process. So then it's about right here where I should label. So then I'll put this back on without it touching the table. And then I'm going to put my skin prep on his nose. I'm just going to put some skin prep. This will just help the tape stick a little better, okay? Okay, and then he said he doesn't want to drink water during it. That happened last time and he didn't like it. So I'm going to get my lube ready. Okay, and then I'm going to wash my hands again. Put on new gloves, and then I'm ready to insert the tube. A modification for the lifespan would be the tube size. You'd want to use a smaller tube, possibly shorter too, for a pediatric patient. And I dropped my connection device on the floor, so I'm going to have my Assistant, grab me a new one from the clean supply closet when I need to connect to suction. So then I'm going to insert into the lube. Alright Bob, ready? So as I insert this, I'm going to have you hyperextend your neck initially, and then as it advances down, I'll have you pull your neck forward and kind of crunch it forward, okay? So first I'm helping him to hyperextend his neck, and I'm going to insert. And then as it passes, I'm going to encourage him to swallow and then bring his neck forward. And he's swallowing and it's going down without any resistance. So he is doing really well. Are you doing okay? And he says yes, he's not having any discomfort. So I insert it to the line, making sure that I'm holding it up until I tape it so that it doesn't become displaced. And then I'll tape it to the nose. And the tape will stick. Okay. How are you doing, Bob? He says he's okay. It's uncomfortable, but he is doing okay. So we didn't need this, and I can attach with a pin to the gown so that it's upright. And what I would do is I would get another piece of tape connect that so that it's always sitting upright. And then next I would be expecting an x-ray to be ordered to check the placement of the tube. I could also use some pH strips, which I brought, to test the aspirate, and that would also check for the placement. So my x-ray came back, so I take off my gloves, wash my hands. My x-ray came back and confirmed that the tube was in the stomach. So now that I know that it's in the stomach, I can continue to do any feedings or medications or connect it to suction. So from the supply closet, I'm gonna call my friend to get me the other connection. And thank you, she gives it to me, nice clean one. So, wash my hands again and put on clean gloves, and then make sure my suction is on low intermittent. And make sure that it's working, and it is working. So then I'm going to connect my suction to the NG tube. And then since I did note the placement, I can continue to give any medications or feedings through that as ordered. I'm going to take off my gloves, wash my hands, and then I'm going to document, after making sure the client is safe and comfortable, which he told me he was, I'm going to document the date and time that I placed this, the size of the tube, how the patient tolerated it, and then I'll continue to monitor.